The horror of COVID-19. How a silent enemy shut down the modern world. The world didn't fall apart with an explosion. There were no sirens screaming across cities, no mushroom clouds, no marching armies. Instead, the collapse crept in quietly. One cough, one flight, 1 week. And suddenly the most advanced civilization in human history was brought to its knees by something smaller than dust. COVID-19 didn't just spread, it conquered. And what followed left scars that still haven't healed. This is the scars of a global storm fronts, and this is the horror of COVID-19. The enemy no one saw coming. History taught us to fear visible threats. Tanks rolling in, bombers overhead. World War II burned that lesson into humanity's memory with fire and steel. But COVID-19 rewrote the rulebook. This enemy wore no uniform. It crossed borders without passports. It ignored armies, wealth, ideology and power. At first, the world shrugged. New virus, distant problem. Then hospitals filled, streets emptied. Flights vanished from the sky. Global trade froze. Within months, entire nations were locked indoors, watching daily death counts like wartime casualty reports. Only this time, the front line ran through living rooms, grocery stores, and hospital corridors. Unlike World War II, there was no clear battlefield. The war was everywhere. COVID-19 didn't just kill people, it dismantled routines. Workplaces shut down, schools went dark, worship halls closed their doors, handshakes became dangerous, funerals became live streams, isolation became policy. Supply chains cracked under pressure. Supermarket shelves went bare. Toilet paper became currency. Medical staff reused protective gear meant for single use, echoing the desperate improvisation seen in World War II field hospitals. Except this time, the war wasn't overseas. It was inside every city. Fear spread faster than the virus itself. Misinformation travelled at the speed of the internet, poisoning trust. Governments scrambled, experts argued. The public watched, confused and scared, as rules changed by the week. Masks on, masks off. Lockdowns tightened. Lockdowns lifted. The uncertainty was relentless. Official numbers tell part of the story. Millions died worldwide. But the real toll goes deeper. Overcrowded hospitals forced impossible decisions. Doctors had to choose who received care and who waited. Nurses worked until they collapsed. Burnout became the norm. Beyond the dead were the survivors who, never fully recovered. There was long-term lung damage, heart problems, neurological issues, and fatigue that just refused to fade. COVID-19 didn't always kill fast. Sometimes it lingered, quietly wrecking lives long after the infection had passed. Mental health, took a direct hit. Anxiety skyrocketed, depression surged, suicide hotlines were absolutely flooded. For many, lockdowns felt like solitary confinement without a release date. World War II left physical ruins across continents. COVID-19 left invisible damage inside millions of minds. In World War II, factories shifted to war production. During COVID-19, factories shut down entirely. Entire industries collapsed almost overnight. Tourism evaporated. Small businesses died by the millions. Workers were laid off through email notifications and video calls. So, governments printed money to keep economies alive, pushing debt to, well, historic levels. And, as a result, inflation followed. The financial shockwaves didn't end when lockdowns lifted. They rolled forward, reshaping global markets, housing prices, and, really, the cost of living. The pandemic exposed just how fragile the modern system really is. A system built for efficiency, not resilience. And honestly, one disruption was enough to shake the entire structure. Yet, in the middle of the chaos, something extraordinary happened. Humanity fought back with science. Vaccines were developed in record time, faster than anything in medical history. A process that once took a decade was compressed into months. This was the counter-offensive, the modern equivalent of cracking enemy codes or mass-producing tanks during World War II. Laboratories became weapons factories. Data replaced bullets. Researchers worked around the clock, racing against mutations and misinformation alike. But even this victory was uneven. Access was unequal. Trust was fractured. Politics poisoned public health. The virus exploited every weakness in global cooperation. COVID-19 didn't just expose weaknesses in healthcare systems. It exposed human behavior under pressure. Panic buying, blame games, tribal thinking, but, also sacrifice, courage. Doctors walking into danger daily, ordinary people checking on neighbours, scientists sharing data across borders. Just like World War II, the pandemic forced humanity to confront itself. At our worst, we hoarded. At our best, we adapted. So, the real horror isn't just what COVID-19 did. It's what it showed us. That progress doesn't equal preparedness. That comfort, honestly, can breed complacency. And that survival still depends on cooperation, discipline, and trust. The world reopened, but it didn't reset. Remote work, well, it became permanent. Healthcare systems are still strained. And public trust, it remains fractured. The pandemic carved a before and after line through modern history. Just as World War II reshaped geopolitics, COVID-19, it reshaped society. It changed how we work, how we gather, and even how we think about risk. And like every global catastrophe before it, its lessons were paid for in human lives. The question really is whether those lessons will be remembered when the next invisible enemy arrives. Because, history is clear. The storms always return. If this deep dive helped you see COVID-19 through a sharper historical lens, make sure you subscribe to The Scars of a Global Stormfronts. Share this with someone who still thinks the pandemic was just a pause instead of a warning. History doesn't whisper, it scars. And we're here to make sure those scars are never forgotten.